Pascrell. I'm from the Englewood Hospital. We have a health fair going today. Tremendous crowd, a lot of services here to get people to understand, take control of your own health. That's our message today.
My name is Steve Eisenman with the Healthcare Institute of New Jersey. We oversee a program called RX for New Jersey.
I'm the facilitator of the Food Allergy and Asthma Support Group of North Jersey. I'm Beverly Jackson. I'm a community recovery specialist with the American Red Cross.
My name is Lily Kleinman and I represent UnitedHouseCalls.com.
I was on staff, I still am on staff at Englewood Hospital. I'm here doing oral screenings and cancer evaluations.
Diabetes Foundation. My name is Bonnie Starr. And we're just here today to bring educational materials to the public regarding diabetes, how to prevent diabetes.
My name is Noreen Tarletsky and I represent the Cystic Fibrosis Foundation. I'm the New Jersey State Advocate Chairperson.
I'm Megan Malsich, the Health Educator for Englewood Health Department.
Hi, I'm Robin Strauss. I'm the Community Outreach and Education Coordinator at the Adler Aphasia Center.
We are thrilled to be the host this year, and we thank Congressman Pascrell and his entire team who have been wonderful in bringing practitioners and volunteers and all of these services and teaming up with all of us at the medical center and providing this incredible health fair today. Congressman Pascrell is a huge advocate for health care, always pushing for the needs of the senior citizens, the sickest patients, whether it be traumatic brain injury or all of the other illnesses that we fight on a daily basis. He's our biggest advocate, and it is my honor and privilege to introduce to you our Congressman, Bill Pascrell.
Thank you. Every year we have our health fair in a different hospital. We're in Passaic County, we're in Bergen and Hudson County, which is my district. Some of you are from outside the district. Great that you're here as well. We've never turned anybody away from our office. We have probably the strongest casework crew in the state of New Jersey in the delegation. If we can't get it done, nobody can get it done for you. You're in a great hospital. When hospitals are closing, you're in a great hospital. I wouldn't say unless I meant it, because I'm always in trouble saying what I think. Seniors to seniors, get with it. Two things are changing. You have to be in control of your health. You, personally. And number two, we're changing the whole scope of healthcare because we're moving away. And this hospital is one of the leaders in the country. Going from the system that we have now, which has driven costs through the roof. Can never have enough state money or federal money to do what we have to do if we continue the same direction we're going in. And that is, we got to end fee for service. What we want bills to reflect is results. That's what you're paying for, results. Many of the seniors in this room have daughters and sons in their 30s and 40s and 50s who got enormous health care problems. One major illness can wipe everything out. So we need to know what we're doing. We need to know what we're doing. This hospital is affiliated with Mount Sinai School of Medicine. It is known for its cardiac and bloodless surgery programs. I like those kinds of surgeries, by the way. They have been serving the community since 1890. They're not just here. 305 beds, ranked as one of the top 5 hospitals in the state of New Jersey. So you're in a real place. You're in the house. I want to tell you a couple of things because we're part of the new era that you and I are going into. Is the Affordable Health Care Act. You better know about it. You better know how it's affected us already. If you're a senior, you're saving money on your drugs already. Most of you don't know what's going on because you don't pay any attention. You turn on Fox News. More than 6.3 million senior citizens and Medicare Part D, that donut hole coverage, remember? Where you were paying premiums and getting no benefits. What the heck kind of a system is that? You have saved over $6.1 billion in just 1.5 years in prescription drugs. Preventive services. This is a preventive service in the other room. It's going to cause many times a little grief, but it's the best thing that happens to you in order to prevent things from getting worse for your health, for your anguish, and for your pocketbook. Because you can have Medicare, and you can have Medigap, and you can have Medicare Advantage, and you can have this, and you can have that. But the question is, we don't want you to have to take money out of your own pocket. Any questions?
Do you think it would be useful if different facilities, doctors, hospitals, and so forth, posted their costs for different services? Basically, when we enter healthcare, we really don't know what a procedure will cost.
And you know what? Sometimes you don't have the time to be a discreet shopper, so to speak, if you're a patient. But the point of the matter is, the quicker we get away from fee-for-service, which we are in now, and move to results for fee-for-results rather, the better we're going to be. Yes, sir.
How can we get interstate competition for accountable care organizations and get rid of the state-by-state limitations?
I think that's a good question. Why can't we have interstate buying of insurance, et cetera, because every state has different rules. And this is one of the biggest problems we have in having competition in the insurance business. You know, in New Jersey, there's only a few people who write insurance, health insurance. That's why the exchanges, which go into effect soon, are very, very important. I think they start signing up in October, if I'm not mistaken, right? October the 1st.
Several years, about 4.5 years to like Medicare.
Yes.
We get our insurance companies, but they've downsized the selection from about 8 vendors down to 3. And my costs have gone up from about $100 a month to almost $400.
Okay, let me say this. Your question of the lack of competition is one of the reasons why we are where we are. That's a problem. The state, well, then that's why you have an exchange. And then the seniors don't have to worry about exchange because they have Medicare, et cetera, et cetera. They're not going to be affected except they're going to save money. They're going to have also free preventive care. So if you're not a senior, as is your case, the question is you need more competition. How do you get it? That's why there was a big debate over affordable health care when there was a solid group of people who want to go for single payer, so that everybody would be treated the same, seniors and non-seniors. We're not anywhere near there. We don't have the votes for that. I support that, but we don't have the votes for that. And that's what you're talking about. Thank you. Get back to those services. Don't leave and have lunch. Bye-bye. Thank you.
Congressman, what do you think the people should be paying attention in the coming year as far as...
Well, don't forget, the Health Care Act really goes into strong effect October the 1st, when these exchanges are going to open and you're going to see real competition, not what you have now, real competition in the health insurance business. And that's healthy. That's healthy for everyone.
Have you visited any victims of Sandy? How's that recovery effort going?
Well, the hospitals responded. All the hospitals responded as far as I can see. You take Moonachie and Little Ferry, which were wiped out in each storm. Not just the shore. Tell Governor Christie that. Not just the shore where the storm affected. It's up here, North Jersey, Moonachie, Little Ferry, Hoboken, Long Island, New York City, all over New York City. And the hospitals, the medical area has responded exceptionally well.
Maria Marciato with Englewood Hospital and Medical